What are confidentiality agreements in CBT group therapy? Imagine sharing your deepest thoughts and feelings in a room full of strangers, but feeling safe enough to open up. That's what confidentiality agreements aim to create. These are formal rules that everyone in a group agrees to follow about keeping shared information private. They are a key part of making sure the group feels safe and trusting. When people know their stories won't be shared outside, they are more likely to speak honestly and participate fully. In group cognitive behavioral therapy, confidentiality means that what each person shares stays within the group. This is different from individual therapy, where only the therapist is legally responsible for keeping things private. In group therapy, all members share this responsibility. The therapist explains the confidentiality rules at the start, usually during the first session. They tell everyone what can and cannot be shared outside the group. For example, if someone talks about feeling sad or anxious, that stays in the room. But if someone mentions harming themselves or others, the therapist might have to report it. These limits are clear from the beginning so everyone understands the boundaries. A typical confidentiality agreement says that members should not share identifying details about others outside the group. This includes names, descriptions, or any specific information that could reveal someone's identity. Members can talk about their own feelings and experiences, but they must avoid sharing anything that could identify another person. The agreement also makes it clear that while the therapist is legally bound to protect client information, other members do not have the same legal protections. If someone breaks the rules, it's a violation of trust and group rules, even if it's not a legal breach. Before the group starts, the therapist reviews these rules with everyone. They may remind the group of confidentiality during sessions, especially when sensitive topics come up. If someone does break the agreement, the therapist addresses it directly, emphasizing the importance of trust. Sometimes, a breach can lead to that person being asked to leave the group to protect others. Trust is the foundation of effective group cognitive behavioral therapy. When members believe their privacy is respected, they feel more comfortable sharing honestly. The therapist models respect for confidentiality and encourages members to do the same. This creates a safe space where everyone can work on their issues openly. Therapists must follow professional ethical standards and laws like the Health Insurance Portability and Accountability Act, which protect health information. They ensure that all members understand these rules during the informed consent process. The therapist keeps notes about individual progress but avoids including details that could identify other group members. Informed consent means giving clear information about what confidentiality means, what the limits are, and how the group works. This helps members make informed choices about participating. Overall, confidentiality agreements are essential for creating a safe, respectful environment in group cognitive behavioral therapy. They help build trust, protect privacy, and support the goals of therapy. When everyone understands and respects these rules, the group can focus on growth and change with confidence.